and whenever you're ready, Nicole.
Okay, let me just figure out how to say okay to that record. There we go. All right, so thank you so much for having me. I love getting to do these presentations and share information about assisted dying. I know there's always a lot of questions around how it works. And like Leslie said, my name is Nicole Finney, and I'm the clinical services manager for the MAiD program in Nova Scotia, but it's a newer role to our team. So before that, I was one of the nurse navigators, so was often kind of the first contact that people would have with MAiD if they were interested in it. So my hope today is that I can give you a bit of a sense of what is medical assistance in dying, who has it and why, a bit about the criteria, and then also what the process is. Because it's not as simple as just, calling your family doctor to say you're interested in assisted dying. There is quite a process. So I also want to start off by giving you an overview of what assisted dying is, and different countries use different language for this. But what it means in Canada is giving a medication to cause someone's death, and that medication has to be prescribed by a physician or nurse practitioner. And the phrase medical assistance in dying covers both IV medication, so an injection of medication, as well as an oral medication, so when the patient themselves would take something to cause their death. But all that to say that doesn't mean anyone can do this. You have to meet the legal requirements first. So you may see the phrase assisted suicide or voluntary euthanasia because there's different phrases used, but I'm going to be using the language of medical assistance in dying, which we frequently shorten to MAiD in Canada. So just a little bit of background. So why was MAiD implemented in Canada? So in 2015, the Supreme Court ruled that not having access to it was against the Charter of Rights and Freedoms. And so in June of 2016, the law passed that would allow Canadians to have access to MAiD. In March of 2021, the law further changed, and I'll get into that a little bit later because it's become more and more complex. So why do people choose medical assistance in dying? So this data is from across Canada, but does largely reflect what we see here in Nova Scotia as well. So contrary to popular belief, people generally don't choose assisted dying because their pain is unmanaged or their shortness of breath. But the main reason people tend to choose assisted dying is loss of the ability to engage in things that give them meaning. So the phrase that we hear time and time again from patients is, when we say, what's made you interested in this? They'll say, I'm not living anymore, I'm just existing. And the numbers across Canada right now, assisted dying deaths make up about 3% of our overall deaths in Canada. And we have this really great information because Health Canada requires that MAiD physicians and nurse practitioners report to Health Canada on every MAiD death that happens. So while it's a bit onerous on the clinicians, it does give us some really good information about what's happening across the country. So the most common diagnosis that qualify for MAiD largely is cancer. That's about 2/3 of all of our patients. And again, this is Canadian information, but it does reflect what we see in Nova Scotia as well. And next most common would be cardiovascular, so things like COPD, congestive heart failure, and also respiratory, so covering things like COPD. But the vast majority of our patients do have a cancer diagnosis. So there's now 2 different categories for assisted dying. And so what that means is that we have different diagnoses that are qualifying. So while our most common is cancer, we have this other category for assisted dying for people who do not have an expected death in the near future, but still meet all the other criteria. For those folks, our common diagnosis is neurological disorders. So maybe something like Parkinson's or ALS, depending on how far along it is, where you could live with the condition for a number of years, but you could still qualify for assisted dying. And to give you a picture of where MAiD is happening, so about half of all of our cases happen in hospital. The other half happen in people's homes, in long-term care facilities. And then we have the always interesting other category, which might mean at a funeral home or on a beach, or essentially here, if someone's asking for a very unique location, we'll do what we can to see what's possible, but that's a very small percentage of them. And our numbers for people who are referred to the MAiD program, so these are the Nova Scotia numbers, and these are on our website as well. So you can see that when the law first changed in 2016, we didn't have many referrals. We had 36 for the whole year. For 2023, we're projecting over 700 referrals. So part of that is that the law has expanded. Part of that is people are just more aware that MAiD is legal and available. And also that we now have more physicians and nurse practitioners that are able to do this. Good to note, though, is that the number of referrals does not mean the number of people who actually went forward with MAiD. So about half of all of our referrals end up with people going forward with assisted dying, and that's for a number of reasons. Some people decide, they've been assessed, and just knowing that they qualify is enough, and they don't need to go forward with it. And other people may die naturally before they decide to go forward with assisted dying. So I have this slide in here about palliative care just because, less so now, but for a while it was quite a common question that we would get. So do you have to choose between palliative care and assisted dying? And the answer is you definitely do not have to choose between the two. More commonly, people who are assessed for MAiD are also followed by palliative care services. So 80% across the country are followed by palliative care as well. And we're really lucky in Nova Scotia, where our program and the palliative care program have quite a good relationship. We keep each other up to date, which is not the case in all provinces. So we've got quite a great team here. So I want to give you a bit of a sense of the criteria for assisted dying. And so this is all laid out in the law. So it's not something that, Nova Scotia has decided. We have the federal law, and then we have to put that into place in our province. So the first few pieces of the criteria are pretty straightforward. You have to be over 18 or older, and you have to be eligible for healthcare services. So meaning if someone called from another country and asked if they could come to Canada to have MAiD, they're not allowed to do that. They do have to be either a Canadian citizen or eligible to receive healthcare in Canada. The other piece of that, and this is really key, is that you do have to have a decision-making capacity. So meaning that the request has to come from the person. You can't make that request on behalf of someone who can't make decisions for themselves. And I'll get into that a little bit more later. Another piece of the criteria is that it has to be a voluntary request. So what that means is that the person cannot be pressured into doing MAiD. It has to be the person that's asking for it. And for this reason, often what our assessors might do is, if they have family members there for the assessment, they may ask those family members to leave the room, at least for part of that conversation, just to ensure that it is the patient that's wanting this and that they're not being pressured by other people. Because if they are being pressured, then they're not going to qualify. So those are kind of the more straightforward pieces of the criteria. This next one is really the main bulk that our physicians and nurse practitioners are assessing. So in order to qualify for assisted dying in Canada, you have to have a grievous and irremediable medical condition. And that's the language that the law has laid out. So it's not typical terms we would use in healthcare, but we have to then interpret what that means. So what it means is that you have to have a serious and incurable illness, disease, or disability that's put you in an advanced state of irreversible decline. So still kind of convoluted language, but really what we need to know is that you have an incurable disease where things are getting worse and they're not going to get better. The second part of that criteria is that that illness, disease, or disability has to be causing intolerable suffering. So whether that is physical suffering or psychological suffering, either is okay, but it has to be intolerable to the person. And it can't be relieved under condition that the patient finds acceptable. So an example of that would be if we had someone with a cancer diagnosis who was having pain that they were finding intolerable, and perhaps they've been offered pain medications that may help to relieve their pain, but they find that those medications make them too sleepy to enjoy their time with their family. In order to qualify for MAiD, they don't have to take those pain medications. They're allowed to say, even though this would relieve my pain, that then affects my quality of life, and that's not acceptable to me. And the reason that I have those two photos up there is that while you might picture the woman on the left as someone who, you might expect to be your typical assisted dying patient, the gentleman on the right could also qualify for assisted dying as long as they were meeting all the other criteria. So having an incurable illness that's put them on a trajectory of decline, and also having intolerable suffering. So another piece of the criteria is that the person has to be able to give informed consent to receive assisted dying. So what that means is that they have to be informed of all of their options, and they don't have to choose those options, but they do need to know what they are. So for instance, if we had someone referred to our team who had a brand new diagnosis and they had not yet met with any specialists or their family doctor to find out what their treatment options are, even if that diagnosis is terminal, they may not yet qualify for assisted dying because they haven't been informed of all of their options. So a big piece of the work we do here in the office is that we're looking at all the referrals that are coming in because we want to make sure people are aware of the resources and the options that they have. So that's all the legal criteria for assisted dying. So what you need in order to qualify is that you need 2 different assessments completed. So we need 2 either physicians or nurse practitioners that have assessed the person to say, yes, they meet all the criteria. And there's also a consent form that has to be signed with a witness. So it's these 3 things that if we had them on file, that we would know someone was eligible for assisted dying. So 2 assessments and a consent form signed. And that's something that our office here would facilitate. So I just want to give you a little bit of information about the law changes. So in 2021, the rules around MAiD were split into 2 different groups. So, and the language that the law uses is reasonably foreseeable death. So those would be people who are going to die in the relatively near future from their illness, and those with a non-foreseeable death. So there's additional safeguards in place for people who have a non-foreseeable death, and which category you're in is determined by the assessor. So for people who have a non-foreseeable death and meet the criteria, they have to go through a 90-day waiting period. So what that means is that they have to have their assessments done and they cannot go forward with assisted dying until that 90-day wait has passed. The other part of the law change is that it's actually called Audrey's Amendment, and Audrey was a woman from Nova Scotia who helped to get this law changed. So there's now an option for people who have a reasonably foreseeable death. They have an option to sign a form that says, I'd like to have assisted dying on this specific date, even if I can't express my consent that day. So, anyone can't do these forms. It does have to be someone who has been assessed. But this law came into place because Audrey was someone with breast cancer and it had spread to her brain. And at that time, because of the way that the law was, she had to choose assisted dying while she could still say on that day, yes, I'd like to proceed. So with the law changes, she would have had this option to sign this form saying, I would like to proceed with MAiD, in January 21st, even if on that day I'm not able to express that for myself. So that's something that the assessors or the physicians would go over when they would meet with the patient. So I know that that part is often quite confusing, and I'm not sure if I explained it well, so I can certainly answer questions around that at the end. So more practically speaking, for people in the community, if you were interested in MAiD, what should your first step be? So it depends. If you're just looking for information and looking to find out more, then your best step would be to talk to your physician or other healthcare provider, or you could also call the MAiD office. We take questions from the public all the time for people who are just looking for some more information on how all this works. Nova Scotia Health also has a website that has some information on it that you can look at, as does this website called Virtual Hospice. But if you call into our office, we can help to connect you to some of these resources. So that would be for someone who was just looking for information. If someone wanted to actually start the process of being assessed, then we would need a referral sent by your physician or nurse practitioner. So you would call your doctor or nurse practitioner and you'd let them know that you were interested in being assessed for medical assistance in dying. And then that physician or nurse practitioner would send us a referral to get the process started. Now, if you're worried about this conversation, like say you suspected your physician or nurse practitioner had religious objections to assisted dying, or you'd had that conversation before with them and then nothing happened, you certainly can call our office and we can help to both explain to that physician what their legal obligations are and to help facilitate that referral another way if need be. So what happens after a referral is sent? So if we received a referral to the MAiD office, you would get a call from one of our MAiD nurse navigators, usually within 2 to 3 business days. And that's just to have an initial conversation around how MAiD works, because it's become increasingly complex, and also to talk about what your wishes and goals are for the timing of things. So after that initial intake was done, we would help to arrange for those 2 assessments and also to get your consent form signed. So that's not something that you would have to arrange. We have a list of physicians and nurse practitioners in the province that do this. So who can do your MAiD assessments? So any physician or nurse practitioner can do these MAiD assessments. It would just depend on their comfort level and experience level. So family doctors certainly do them. Specialists sometimes do them, but more commonly it's going to be someone from our list that we have here in the office. So we have a list of people across the province that do assisted dying assessments. And we also have 4 nurse practitioners that work in each of the different zones, health zones, that work with us either full-time or part-time to do these assessments. So what's involved in an assessment? So usually what this looks like is you'd get a call from either the nurse or the physician or nurse practitioner themselves to book a time. Typically, they would come to your house to do the assessment. And they will have reviewed your health records beforehand because they want to confirm your diagnosis and see which specialists you've already met with. And then they would meet with you usually for 30 minutes to an hour. And they'd be going through that criteria with you and be asking about your understanding of your illness and your options, as well as wanting to hear about why you're interested in assisted dying. And then that second assessor would do that exact same thing. So I just have a few slides that are kind of common questions that we get from people. So can I still have MAiD if I lose the ability to make decisions about my healthcare? So it depends. You may be able to under Audrey's amendment if you're in the reasonably foreseeable death category. You must have decision-making capacity during the assessments. So, if you had a family member who had severe dementia, and then, you had known that years ago they were asking about assisted dying, we wouldn't be able to go forward with that because they need to have decision-making capacity during the assessment portion. If someone did, meet all the criteria and wanted to have MAiD down the road and did not have decision-making capacity down the road, they would have to make a written arrangement between them and the MAiD assessor that says, I want to have MAiD on this date, even if I can't consent for myself that day. And the patient signs it, and the assessor, the physician or nurse practitioner has to sign it as well. So can you request MAiD on behalf of someone else? No. So you can't call us and say, my mom has a terminal illness and I think she'd be interested in MAiD. That request must come from the person themselves. If someone has dementia, can they have MAiD? The answer to that is maybe. Like I said before, as long as they have decision-making capacity, then they may be able to meet criteria. And sometimes if it's not clear when we receive a referral on someone who has dementia, our team may reach out to other psychiatrists or other specialists who can really dig into capacity and whether someone is appropriate to be assessed for assisted dying. So can you be assessed for MAiD without a diagnosis? So no. So we've gotten calls before from people who maybe have a history of breast cancer in their family or ALS, but they're not diagnosed yet, and they're wondering if they can kind of get set up for assisted dying down the road. But we can only, under the law right now, we can only assess based on your current illness, disease, or disability. So, I mean, sure, if we sent someone out for an assessment, they could meet with you, but that conversation would stop as soon as they got to that criteria that said you have a serious and incurable illness, because you would not at that time. If you're interested in assisted dying, when should you have your assessment? And do you know what? I need to update this slide. For a while, our wait list was months to get assessments done, but because we've hired our nurse practitioners, that wait list is much longer. I'd say it'd be in the range of a few weeks, maybe a couple months. But you want to be assessed when you feel you'd meet the criteria as well. So where part of the criteria is having intolerable suffering, as determined by you. If you were feeling really good and you didn't feel like you were suffering and the assessor went to see you, well, when they ask you about that question, you're not going to meet that criteria. So you do want to be assessed, when you feel you'd meet the criteria, because otherwise we're not going to go forward with the rest of the process. So does someone have to be sure they want MAiD before they're assessed? No, it is absolutely fine to be referred for assisted dying if your thought is, you have cancer, you're worried that you may want this down the road, but you're not really sure. That's totally fine. And that's not going to affect your eligibility. In fact, I'd say it's pretty common that we hear from people who say, they want to have their ducks in a row or they want to have the option in their back pocket. So what if someone chooses a date and then changes their mind? That is absolutely fine and certainly does happen. There's no kind of penalty for that. You don't need to redo your assessments. If, say, someone told us, I want assisted dying on August the 9th, and they've signed that form with the physician saying they want to go forward, our nurses will check in with that person a couple of weeks beforehand to see how they're feeling and seeing if, they do want to proceed or not. And if they don't, that's fine. We can either just put things on hold, or they can choose another date down the road. So I just want to briefly mention some of the changes that are upcoming with MAiD in Canada, and then I'll answer your guys' questions. So in March of 2024, the law is also going to allow for mental illness to be a diagnosis that qualifies for assisted dying. So our team in Nova Scotia has been working with the psychiatric community to figure out how we're going to safely do that. So that law will change March 17th. And then the other change that there's not a date for, but it's a really hot topic of conversation across the country, is what's called an advanced request. So that would be for people who, like I said before, don't have a diagnosis, but are worried about a situation down the road. So people are advocating for being able to put in your advanced directive or living will that says, you know, if I have a stroke or if I have this situation, I want to have assisted dying. So we don't have a date for that yet, but there's a large public push for it. So I wouldn't be surprised if in the next few years that by law you were able to put that into your advanced directive or living will. So that's all I had for my slides, because I wanted to leave some good time for questions. I'm just gonna stop sharing my screen just so I can see faces again. And I apologize, I wasn't able to see the chat. So Leslie, I may leave it to you to kind of give me the questions.
Sure. I have been checking on the chat. There aren't too many questions, just one question that we hear a lot these days about the availability of doctors and people who are unattached from physicians. So how will that work for those people?
So like if they didn't have a family doctor and they needed a referral sent. So typically, if we heard from someone who didn't have a family doctor, we'd often help them get connected to their specialist. What we found so far is that if you have a serious and incurable illness, typically those people are followed by some sort of specialist. If they weren't, then we may reach out to one of our own MAiD physicians to have them refer them to the program. So far, we've just been kind of doing workarounds on a case-by-case basis, or helping people get connected to some of the unattached patient clinics.
Thank you. Anybody that's watching via Zoom, just if you want to put your hand up or just unmute and jump in with a question, please go ahead. People who are here at the old school, if there's anybody here with questions. Yeah, we've got a question on the floor here. You can come over and speak, or you can relay through me.
I can relay through you. When she was talking about criteria, under non-reasonably foreseeable death, she said there's a 90-day wait unless they're going to lose capacity. And then she said consult with an expert required, and that there's no option for advance consent or a waiver or final consent. I'm just wondering, what does she mean consult with an expert required?
Or I could hear that, Leslie. Thank you. So the question was around safeguards under the non-foreseeable death category. So one of those safeguards is that, and by law, is that we have to consult with someone who has expertise in what's causing the person's suffering. So that may be the assessor themselves. So, you know, we have a wide variety of physicians and nurse practitioners who do this work. So say we had our assessor who was a neurologist seeing a stroke patient. They can be the expert in that case. And the purpose of the expert is to not, it's not their role to say this person meets the criteria or not, or you're eligible for MAiD or not. Their role is to make sure that all options have been explored, or at least that you've been informed of them. Because we sometimes and not uncommonly we'll get referrals from people who, maybe they have a chronic illness, but they haven't seen anyone to discuss treatment options for that illness in maybe 15, 20 years. And so medical practices have changed in that time. So in order to make sure they're informed of all their options, we'll consult with someone with expertise.
Katie, does that answer your question there?
Yes, and I'm also curious if they deal much with people who are pursuing MAiD because of like poverty-related struggles.
So Lisa has put a question about that in the chat as well. So what about people whose intolerable suffering is caused by lack of support for social determinants of health, lack of money for food, medication, precarious housing, that type of thing?
So that's been another hot topic of conversation, especially with the mental illness law changes. So part of the law is that the intolerable suffering has to be directly linked to your physical illness. So we have had cases where people have a chronic illness, they're referred to the program, but when we ask them about their suffering and their reason for asking for MAiD, they've said, well, my housing is inadequate and I don't have enough money to buy food. And in that case, even though they have a chronic illness that may qualify, their reason for asking for MAiD is not linked to that illness. And so they may not qualify for assisted dying. We thankfully in the last 6 months have also hired 2 social workers to work on our team. It's to have those conversations as well and help to get people linked to supports as appropriate. But you could not qualify for MAiD if your suffering was directly linked to those pieces. But I also want to acknowledge that it's not always as clear cut as that. And there's a lot of your social determinants of health are going to intertwine with your illness.
This could be impacting your ability to provide for yourself.
Yeah, absolutely. Or access to medications that would help to control your symptoms too. Yeah. And what our team will do too is if it's complex like that and it's unclear, how those are linked, we have a team meeting that we do every Friday where if there's complex cases that we'd all work together to figure out appropriate next steps. And our motto too is that this is not something that should be rushed. So if it takes time to explore other resources, then so be it. We would never want to go forward with assisted dying without ensuring all options have been explored, or at least informed to the patient.
Nicole, is that not part of the law around MAiD, that people seeking that do have to be have access to any other supports that could help ease their
Oh, you're muted again, Leslie.
Is it part of the law that people seeking MAiD need to be offered kind of more extensive supports, any supports that are available to them before they can access MAiD itself?
Yeah. So they'd have to be informed of those resources. The key piece being that they don't have to take them. So if we had someone who was living in their home and didn't have any home care, and we thought, this could really change your quality of life, our role and the assessor's role could be to inform them of home care and how that works and get them connected if they're interested, but they do not have to do it.
If you have a history of Alzheimer's and dementia in your family, you cannot prearrange to say, okay, if I would ever get that disease and I get to a certain stage that I can have MAiD. Can you prearrange that? Is a law that you can do that with a lawyer or doctor by now?
Did you catch that, Nicole?
No, I heard some of it. Can you recap for us?
Okay, Maria, can you listen to what I'm saying so I make sure I get the right question? So I think what Maria is asking is that if there is a history of dementia or something like that in your family, if it's if people are able to access it for a potential future condition. Is
Yeah.
that?
If you get to a certain stage, that you say, okay, fine, if I get to stage 4 or 5, I would like to have the assessment made, because at that point, you cannot say yes anymore, because you are diagnosed with a disease, and it doesn't qualify to be aware in your right mind type thing.
So yeah, so what Maria is looking for is a little bit more information and clarity on what happens when somebody reaches a stage where they're not able to make the decision themselves, but they're starting through the process and they reach a stage where they can't make the decision themselves. How does that work?
So we'd have to do, in order for you to qualify, we would have to do the assessment when you had the diagnosis. So we couldn't do it kind of in anticipation of a diagnosis down the road. And you'd also have to do the assessment while you had mental decision-making capacity. So for something like Alzheimer's, you'd have to have that diagnosis, and we'd have to do the assessments before it progressed to a point where you couldn't make those decisions for yourself.
You don't qualify anymore to make that decision.
No,
That's what I was told.
no, in the early stages of Alzheimer's, you may still be able to.
You can still do that?
Make decisions.
Okay,
The
that's
doctor
fine.
would, yeah.
Okay.
Yeah. And so that's like a very common question that we get around Alzheimer's and dementia. So having just that diagnosis doesn't mean that, someone is saying, now you've got an Alzheimer's diagnosis, you can't make any decisions for yourself. It's more nuanced than that. And if it was unclear, if someone was referred and, we weren't sure if they had decision-making capacity, maybe it changes day to day, that's when our team would pull in someone who had specialist expertise in that area, which is often our geriatric psychiatrists, because that's kind of their bread and butter, and that's what they do every day is capacity assessments.
So just to clarify, you can't arrange it before that happens.
Correct.
So I have a follow-up question. So if you're newly diagnosed with Alzheimer's and you still have capacity to make your decisions, could you go through the MAiD process, do the assessments while you have capacity, and do the waiver so that you could have MAiD in the future, and not have to do that final consent if you were lacking capacity at the time, and kind of push it out every year until you're at a stage where you and your family know this is where you did want to enter into?
So you could, but only if you're in the reasonably foreseeable death category. So that's the difficulty with a diagnosis like Alzheimer's. If the person doesn't have other illnesses that are going to affect their life expectancy, oftentimes those people are in the, or if they're very elderly, oftentimes those people are in the oftentimes those people are in the non-foreseeable death category. And so they're not allowed to do a waiver of final consent. So until they're in that reasonably foreseeable death category, they do have to consent for themselves on the day of assisted dying. And that's why there's such a big push from the public across the country to have that changed, because it really does kind of leave out people with Alzheimer's from accessing MAiD in the same way.
Alzheimer's is the terminal condition, except sometimes it takes years to reach that final stage where it would end your life, right? But
Exactly, yeah.
They're gonna revisit it, though, she said.
Renee, I see your question about, I see your question there, but I just want to kind of, I have a kind of a bit of a question that relates to the topic right now. So what we're talking about right now, is that what Quebec has just done? Because they have from what I understand, I haven't had a chance to look into it too much, but from what I understand, they are allowing people to make the request for MAiD without having any type of situation that would warrant it under the laws that we have here in Nova Scotia.
I believe so, but I don't want to speak on that right now because Quebec has been so different from the rest of the country on their laws, so I'm not as up to date on those.
I have one more.
One more from Katie to do with this topic.
Yeah, reasonably foreseeable death. Is there a time frame for that language? Like, is a reasonably foreseeable death within a year, or like, what is the? Because
So there's no specific parameters around it. It's been up to the provinces and individual clinicians to interpret what reasonably foreseeable means. For most clinicians, I would say they view that as, expected to die within the next year naturally from their illness. But there's no law or policy around it. So it is up to the individual assessor to determine what category you fall into.
I'm going to get to this question in the chat first, and then I'll get to yours. So we have a very practical question here about any potential costs associated for MAiD for the individual who's requesting it, or is it all covered by the healthcare system?
So everything is covered by the healthcare system. There's no cost for assessments. The medications are all covered through the province as well. The only cost that has been incurred before is if someone needed ambulance transport to hospital to have assisted dying. We can't cover the cost of the ambulance. So that fee could be incurred, but the rest would be covered.
Thanks. Okay, go ahead.
Keep talking about terminal illnesses, Alzheimer's, cancer, things like that. What if we are involved in a motor vehicle accident, in the hospital, comatose, no quality of life? Can I put something in my living will or directive to ask for MAiD?
Not currently. So currently we would need to assess you while you still had decision-making capacity. So, and you'd have to have that diagnosis when you're asking for it. So you can't really plan for a future accident like that would happen. That's more where advanced directives would be more important, where you're really clear on what interventions you wanted in hospital. So separate from MAiD, but you would need to be clear in your advanced directive and speaking to your substitute decision maker around what interventions you'd want in that circumstance.
Thank you. Sarah, did you have a question? Sarah Scott?
No, sorry.
Okay, no. So we do have another question in the chat here. The question is, when does the patient get their approval for MAiD? Is it face-to-face at the end of their second in-person?
So it depends. If at the end of that second assessment, the physician or nurse practitioner is sure that you meet the criteria, they may tell you then that, yes, you've met all the criteria, you've got both your assessments and your consent done, you're kind of teed up, we've got what we need. Sometimes it may happen that the second assessor or first assessor meets with you, and after talking to you, they're not sure, and perhaps they need to consult with other physicians or specialists, or speak to colleagues if it's a more complex case. In that case, they may get back to you by phone to say what their result was. So commonly, they would tell you during the assessment face-to-face, but there are circumstances where they may need to do some work in the background and then come back to give you the answer.
Nicole, is it the same as every other death at home? Like the medical examiner comes afterwards and that kind of stuff?
No, so because the physician or nurse practitioner would be there, they can fill out the death certificate right at that time. And so what typically happens is they fill out the death certificate and then the family would call their chosen funeral home to come and pick up the body. So we don't need police or the coroner or anything like that.
Awesome. Thank you.
Okay, we have another question on the floor here. Betty Ann?
I had a friend who went through this last year with her husband, I believe he had Lou Gehrig's or something. And I was confused a little bit by it because every time he met with whoever he met with, the committee, she would leave because it seemed like she wasn't allowed to be there, or he had to meet with them directly or something. So I'm thinking, so if it was my husband, I would assume I could go in and meet with them, or they would come to the house and I would be in on most of the conversation, other than there might be some parts where I was asked to leave the room or something. And this is sort of contrary from what I gathered from her. Can you address that at all in any way?
Yeah, so I'd say more commonly, family is present for the duration of the assessment. Some clinicians, like some physicians or nurse practitioners, may, in their own individual practice, prefer to meet primarily with the patient without family present. I'd say that's probably not the norm, but it may happen. And I guess what I'd recommend, like if that happened and you were, like you said, you're feeling like, well, I want to meet the person and talk to them, it certainly would be appropriate to ask the physician or nurse practitioner to have some one-on-one time with them afterwards.
Thank you. We have another question here.
Can a physician offer MAiD as a choice to a patient when they know they're heading towards end of life and they're talking about goals of care? I know you said in the beginning it's not to be encouraged, it's not to be pushed on them, but can they offer that as a choice?
They certainly can, and in fact, we have that built into our Nova Scotia Health policy around MAiD. So physicians and nurse practitioners are the only healthcare providers that are allowed to bring it up with someone. So like a nurse would not be able to suggest that. It would have to come from the patient requesting it. But physicians and nurse practitioners, as long as it's appropriate, where they're talking about end of life options, they are allowed to bring it up.
Thank you, Nicole. Any other questions here at the old school?
I just one quick one. The same person last year had a date picked out, his dying date. And my husband and I do music, so we were going to go in that week of that just to play a little music. And the morning we were planning to go, in the mail, I received a notice saying that he had died the week before. So the date had been moved closer. So there sounds like there's some flexibility at some point after you choose a date, if you had sort of choose a date and that you think that's your firm date of death, but there's some flexibility then to move that?
Oh, absolutely. It's all driven by the patient themselves. So you're right. Like sometimes people may think, okay, I'm choosing this special date a month from now. That's really significant to me. But then as the weeks progress, their health condition is changing and they want to move that date closer. And that's absolutely okay. When we get a request for MAiD, you know, the first piece is around the patient's choice around their date, but then in the background, the other pieces we need to sort out are, can we get the assessor there? You know, because that's obviously is going to affect the date as well. And also getting access to the medications, which usually takes a couple days too.
You sound of mind to move that date though, wouldn't you?
Just in case you didn't hear, Betty asked
Okay.
if you have to be sound of mind to move the date.
So it depends. So if you have a waiver form signed, like say you wrote on that form that I want MAiD July 30th, you've signed it, the physician has signed it, and then a few weeks before then something happens and you're now comatose or you can't communicate your wishes, then we can move that date forward. The law does allow for MAiD on or before the date that you've chosen. We would just need to be notified by your decision maker.
Thank you. Any questions, any last questions from our online audience? No, I don't see any questions coming up. So I'm going to thank everybody for joining us today. I think, yes, I will be sending out the recording by email. And there was another question about your presentation, Nicole. Would you be able to share that with the group as well, the people who have registered?
Yeah, for sure. I can send that to you, Leslie.
Excellent. I can send that out to everybody. One more question here at the old school.
Is there a chaplain as part of their team?
Do you have a chaplain on your team?
We do not, and we've been talking about that as kind of a missing piece. What we've been doing right now is that if a patient or family is asking for that, then sometimes we're just calling around to churches if they don't have a chaplain or church of their own, trying to find someone that would go in. So I'd say it's a gap, especially in hospital. It's easier, but for people in the community who don't have their own religious organization that they're connected with, it's often us nurses just calling around trying to find someone.
Okay, and another question here? Go ahead, Heather.
So on that note, can you tell us who would be present in the room as the team? And I did see in an email at some point that there's a pet associated with MAiD, that did I read that? That there is a.
So we have a dog in our office. That's probably what you might have seen. So in terms of who's there for the actual MAiD death, so the physician or nurse practitioner is present, and then sometimes we may have a nurse, whether that's someone from our team or the VON nurse or community nurses who put the IVs in. I'd say most commonly though, it is just the assessor.
All right, I think if any other questions pop up, feel free to let me know and I can communicate those to Nicole and get back to whoever has any additional questions. Oh, well, let's just take this one last one.
That's an easy one.
Okay.
Yeah. if the patient wants it. So it's all determined by the patient. If they say they don't want family there, then they're not going to be there. But if the patient wants it, that's great. We've had people do it, just them and the physician, and we've had it just them and 30 of their closest friends and family. So whatever the person wants.
It really sounds as if you're really putting people who are looking for this service first and honoring their wishes. That sounds it's really nice to hear that.
Absolutely.
Well, thank you so much, Nicole. This has been so informative. I think it's a topic that we hear a lot about, but not very many of us really know the ins and outs of it. So it's been very helpful to have you join us today and give us this really valuable information. So thank you so much. Thank you, everybody that's joined in, and I'll be in touch soon with a recording. I will also send out a very quick evaluation online with some very quick questions on it. If you don't mind taking 5 minutes to fill that out, that helps us plan our programming and find out what people are interested in and how we can make improvements. Thank you.
Wonderful. Thanks so much, guys. This was great.